Ahlan biku. Today we will talk about the Pterygopalatine fossa. So let's begin. It's a pyramidal shaped or inverted pyramidal shape or inverted tear drop shape space deep in the skull behind the maxilla, and it's in a very strategic position because it connects to many areas, many regions, like the oral cavity, like the infratemporal fossa, like the nasopharynx, like the middle cranial fossa, the orbits, and the lateral wall of the nose. So it's a very strategic point where the maxillary nerve will give its branches to these through these tight passages, to these areas. And it's the site of the pterygopalatine ganglion as well. So you will find the terminal branches of the maxillary artery, and the third part of maxillary artery, the maxillary nerve and its branches, and the pterygopalatine ganglia in this space. The boundaries of this space, see, this is to be oriented the left side of the skull. This is the back of maxilla and the zygomatic arch. These are the pterygoid processes. This is anterior, this is posterior, and inside is going medial or deep. Now, the medial wall of this cavity, which is the pterygopalatine fossa, the medial wall is the palatine bone. The anterior wall is the back of maxilla, as you see. And the posterior and superior walls are the upper ends of the pterygoid processes. See? It forms the posterior and superior wall. This area is the pterygopalatine fossa. Now, if you stand here and imagine yourself standing here, you look forward, you'll find the inferior orbital fissure at the top. And if you look back posteriorly, you will find this area. You are in this area of the skull, in front of the sphenoid bone. See these two foramina? This is the foramen rotundum, where the maxillary nerve will come through and be a part of the pterygopalatine fossa, and the pterygoid canal that contains the nerve, the pterygoid nerve, and or the Vidian nerve, and the pterygoid branch or pterygoid branch of the maxillary artery. Now, this is the pterygoid canal. And this is the foramen rotundum. The foramen rotundum connects it to the middle cranial fossa, as well as the pterygoid canal. It's for the to the middle cranial fossa too, but in a different site where the internal carotid artery is. The canal, the pterygoid canal, runs horizontally, as you can see. This is the canal. From the site of entry of the internal carotid artery forwards in a horizontal canal on the base of the pterygoid processes, actually, and ends up in the back or posterior wall of the pterygopalatine fossa. Now, there are 7 foramina, or so-called gateways, that you can get into the fossa or get out of the fossa. Like laterally, this is to be oriented lateral, medial, anterior, and posterior, and superior, inferior, okay? So let's start with the inferior part, the inferior passage to the oral cavity, which is the palatine canal. The palatine canal contains the greater and lesser palatine nerve and vessels. But the old name for these vessels, because before they split into greater and lesser palatine, was the descending palatine artery and nerve. This is in older books. So this is to the oral cavity. Here through the pterygomaxillary fissure, the one I showed you last time, to the infratemporal fossa, and this is actually how the maxillary artery enters to the pterygopalatine fossa, and how the posterior superior alveolar nerve leaves the fossa to the infratemporal fossa to supply the back, to pierce the back of maxilla and supply the teeth. Okay, now posteriorly, I mean, there's a canal called the palatovaginal canal or the pharyngeal canal. The pharyngeal canal contains the pharyngeal nerve and pharyngeal vessel, artery from the third part of maxillary. Now, posteriorly, as I showed you in the last specimen, there was the opening of the pterygoid canal that contains the greater and petrosal and deep petrosals to join together to form the nerve of the pterygoid canal. There's another name for that nerve, is the Vidian nerve. Okay, and I told you that the pterygoid canal opens to the middle cranial fossa where the internal carotid artery is. Now, higher up than the pterygoid in the posterior wall is the foramen rotundum that leads to the middle cranial fossa and contains the maxillary nerve, of course. Now, superior and anterior is the inferior orbital fissure, where the infraorbital nerve and artery pass, and the zygomatic nerve branch of the of maxillary also passes here through the inferior orbital fissure, and medially through the sphenopalatine foramen, the one we saw in the lateral wall of the nose. Remember when we talked about the nasal cavity? It's above the posterior end of the middle concha in the superior meatus. Remember that? It's that's formed by the upper end of the palatine bone and the sphenoid. This is the sphenopalatine foramen that allows for the passage of nasal branches and the sphenopalatine nerve as well to the lateral wall of the nose. Okay? Now, the contents of the pterygopalatine fossa is the maxillary nerve and its branches, the terminal part of the maxillary artery, the third part, the one beyond the inferior head of the lateral pterygoid. As we saw before, that after the lateral pterygoid, it enters through the pterygomaxillary fissure to the pterygoid fossa, and the pterygopalatine ganglion, of course, and the nerve of the pterygoid canal that carries both parasympathetic and sympathetic from two different sources. The parasympathetic from the great petrosal nerve that will synapse in the ganglion, and the postganglionic sympathetic that will be distributed with the branches of maxillary nerve, and usually it acts on blood vessels and veins and lymphatics, of course. What do you think the veins will be? Yes, connecting the pterygopalatine fossa to exactly the pterygoid venous plexus in the infratemporal fossa. Okay, let's start with individual structures, like the maxillary nerve, for example. It's from V, which is 5 in Latin, trigeminal, and it's the second branch, so it's V2. V1 and V2, ophthalmic and maxillary, are purely sensory, while we said before that the mandibular is the only one that carries motor fibers to muscles of mastication. So maxillary, the one we're talking about today, is purely sensory. Pass anterior in the fossa, and you can consider the infraorbital nerve is the terminal branch. It gives off the greater and lesser palatine nerves. Now, I told you before it was named before the descending palatine that gives off the greater and lesser palatine nerves, but now it's considered the greater that gives the lesser palatine. Of course, you know, they descend in their canal and reach the the roof of the oral cavity, the lesser palatine goes backwards on the soft palate, while the greater palatine goes forwards under the mucosa, covering or lining the hard palate, and ends by supplying the incisive gum and oral mucosa. Okay? Now the greater palatine as well, while in canal, gives additional branches to the nose called the posterior inferior branches, because the posterior superior branches are given up directly by actually not directly, it's branches that pass through the ganglia and to the wall of the nose. Okay, now these nasal branches given off by the maxillary, one of them, multiple branches actually, they pass through the sphenopalatine foramen to supply the lateral and medial walls. The one of these branches is the nasopalatine. The nasopalatine, or the nasopalatine nerve, will cross to the medial wall of the nasal cavity. Remember that, descends on the septum and ends by going through this incisive canal. Right? You remember this from the nasal cavity and oral cavity, and ends by supplying, of course, the wall and supplying the gum and mucosa of related teeth, like the incisors and canine teeth. Okay? So the greater and lesser palatine nerves and nasal nerves. What else? A pharyngeal branch. Pharyngeal branch passes through the what's so-called the palatovaginal canal, runs posteriorly and downwards. When you run posterior and downward from the site of the pterygopalatine fossa, you will hit the roof of the nasopharynx. So it goes. This is how the maxillary nerve supplied the nasopharynx. Remember, in the nasopharynx, the one that's always open and made and walls made by a membrane, the pharyngobasilar fascia. Now its mucosa is supplied, as we learned before, by the maxillary. This is how the maxillary reaches the nasopharynx, through the palatovaginal canal. Now it gives another nerve directly, not through branches through the ganglion, the zygomatic nerve, that enters the inferior orbital fissure, and it's on the lateral wall of the orbit. And the zygomatic gives zygomaticotemporal, zygomaticofacial, facial that will supply the front of the zygoma, and temporal, the back of the processes of the frontal and zygomatic bones, means part of the temporal fossa. Right? We studied this, the zygomaticofacial and zygomaticotemporal. I told you before that we will assemble or collect the nerve supply and blood supply of the face during studying individual nerves. This is how it's done. This is how this part of the face is done. Now I want you to remember this connection between the zygomaticotemporal and the lacrimal of ophthalmic. This carries the parasympathetic to the lacrimal gland. Okay, so don't forget the branches of the zygomatic nerve. What else? A nerve leaves the fossa and goes to the back of maxilla to supply the posterior teeth. This is the posterior superior alveolar nerve that supplies the molars. Remember this? And it's all connected, the teeth are all connected through a dental plexus. It enters through a small foramen at the back of the maxilla. What else it gives? It gives ganglionic branches. Actually, doctors, the ganglionic branches, one of them is, some fibers is from the greater petrosal, that is the pre-ganglionic parasympathetic, and on their way to synapse with the ganglion, the origin from the nerve of the pterygoid canal, of course. and the other branches are the way the maxillary nerve supplies the area. The branches that go through the ganglia without synapse, I mean, they do nothing in the ganglia. They just pass there. See, so these branches, the ganglionic branches, are the nerve we're going to talk about, like the pharyngeal nerve, right? Like the descending palatine, which is the old name for the greater palatine and lesser palatine. All these are called ganglionic branches. Okay? And the sensory fibers, of course, coming through to the maxillary nerve. Now, what else? Gives the infraorbital nerve. This is the infraorbital nerve. Goes through the inferior orbital fissure, considered as a continuation of the maxillary nerve. Passes on a groove in the floor of the orbit, supplying the surrounding area. Okay? And it continues through a canal now. It was in the groove, and then it sunk down in the floor of the orbit in its own canal and opened at the face. Now, in the canal, it gave the anterior superior alveolar. Okay, anterior superior and middle superior alveolar to complete the supply of the whole set of the upper jaw teeth, and ended up by supplying palpebral branches to the lower eyelid, nasal branches to the nose, superior labial branches to the upper lip. This is the course of the infraorbital nerve. What else? We have the nerve of the pterygoid canal. See? The nerve of the pterygoid canal is a union of the greater petrosal and the deep petrosal. The greater petrosal is, or the great petrosal nerve, is coming from the geniculate ganglion of the facial in the middle ear. It ran in its own canal and emerged from the petrous part of temporal bone, passed under the internal carotid artery, and it reached the upper part of foramen lacerum, which is cartilaginous, joined by a branch C, this branch, from the plexus around the internal carotid artery, which is the deep petrosal nerve, to form the nerve of the pterygoid canal that will pass through the pterygoid canal we studied before, and it will synapse in the pterygopalatine ganglia, and the sympathetic component will be distributed with the branches of the maxillary nerve. Now, so the great petrosal is the parasympathetic, preganglionic parasympathetic. It is the nerve of the fossa. It is the nerve that made the ganglia. Okay? Now, the deep petrosal, we said it's sympathetic from the plexus around the internal carotid artery, and they are postganglionic. From where? From the upper cervical sympathetic ganglia. From where did it get its sympathetic flow? From T1 segment, okay? Because I mentioned before that sympathetic outflow from the spinal cord is only from T1 down till L2. These are the segments which give the white ramus communicantis. I think, yes, we discussed this with the cervical plexus a long time ago in the posterior triangle. Okay, now back to the deep petrosal, the sympathetic. It will be distributed through the branches of the maxillary nerve and mainly to blood vessels, acts on blood vessels. Now, the ganglia itself, it's the largest of the ganglia of the head. We have 4 ganglia in the head: the otic, the submandibular, the ciliary, and the pterygopalatine. The pterygopalatine is the biggest of all, and now you know where it lies, and formed by the preganglionic parasympathetic from the great petrosal, to be precise. Okay? Postganglionic fibers distributed through the maxillary nerve. Now, the parasympathetic fibers through the maxillary nerve, they reach the all the glands above the oral fissure, including the lacrimal gland. The lacrimal gland is high up in the superolateral surface of the orbit, superolateral part of the orbit. So how to deliver parasympathetic postganglionic supply to the gland? The only way possible is through the zygomaticotemporal, hitchhiking zygomaticotemporal. Then zygomaticotemporal, the parasympathetic discovered that the zygomaticotemporal will continue on its own way to a different destination, so it jumped off from the zygomaticotemporal and took the closest hitchhike directly to the lacrimal gland, which is the lacrimal nerve. See this connection? The zygomatic branch itself is in the lateral wall of the orbit, and the connection is in the lateral wall of the orbit, I mean under the lining of the orbit, and it goes to the lacrimal nerve, then directly to the lacrimal gland. This is how the lacrimal gland got its parasympathetic supply. That was all about the branches of the maxillary nerve and how they are delivered to their destinations. Yes, there are many, but each branch is unique, and you will not be able to forget them. I mean, it's easy, but plenty but easy. Now it's the turn for the maxillary artery. Which part? The third part of the maxillary artery. The one after the inferior head of the lateral pterygoid. It entered the pterygomaxillary fissure and to the pterygopalatine fossa, where it will give its branches. It will give the posterior superior alveolar, as we said before, and it is multiple and enters through multiple foramina. Remember this in the supply of the upper jaw. It will give off the inferior orbital artery. The inferior orbital artery on its way will give the anterior superior alveolar arteries, and will end up the same like the nerve, supplying palpebral, nasal, superior labial branches. It will give off the greater palatine artery that will descend down. The same story of the nerve, that will divide into greater and lesser palatine arteries, and they will supply the soft palate by the lesser palatine, greater palatine, the hard palate. It gives off a pharyngeal branch through the pharyngeal canal, the palatovaginal canal, accompany the nerve of the accompany the pharyngeal nerve, which occupies the pharyngeal branch, pharyngeal canal, and the sphenopalatine artery that goes through the sphenopalatine foramen to the lateral wall of the nose and supply the lateral and medial walls of the nose by lateral and posterior septal arteries. Lateral for the lateral wall, septal for the medial wall, and we have the artery of the pterygoid canal that goes through the pterygoid canal with accompanying the nerve of the pterygoid, which is the great petrosal and the deep petrosal. Okay, this is about the branches of the maxillary artery. Note that we didn't say a zygomatic branch here, like the nerve. This is a difference. The zygomaticofacial and temporal will be the job of the ophthalmic artery. Okay? Not the maxillary artery. Right? Not like the nerve. Okay. You got this point. The veins of the area is converge to the pterygoid venous plexus through the pterygomaxillary fissure, of course. We said that the pterygoid venous plexus drains everything, almost everything there around it, including the inside the cranial cavity through emissary veins, and and meningeal veins, okay, that drain into it. And sometimes, in few cases, the infraorbital will not connect to the pterygoid venous plexus through the pterygopalatine fossa. Instead, it will empty direct into it through the inferior orbital fissure. Sometimes, a normal variation of the venous drainage. Well, I hope I managed to simplify the topic, which is tough and complex when you read it in books. I hope you have at least 70% of an idea about how the pterygopalatine fossa structures are arranged and what are the branches, and to be oriented with this strategic position. Thank you very much for watching.